So we are going to stretch the lats. It's not a specific stretch. It's also going to get some other muscles, the teres, the rhomboids. And so when you're thinking about this stretch and the specificity towards the lats, not so much. It's going to get a lot of other structures. One thing to think about is that thick thoracolumbar fascia that's going to come down. And so for your patient, having them in a sort of posterior tilted position by either bending up their knees, maybe you can have them like with a verbal cue press down into the mat, thinking about getting them a bolster, but something that is going to get them in that position to where they're in more of a posterior pelvic tilt, okay? And for that reason, we're going to stabilize the ipsilateral iliac and just feeling to see if there's any tilting, okay? So I just want to be right off to the side of the pelvis and just feeling for any compensations. So for this position, the upper extremity is going to be very similar to what we saw for our pec muscle when we're doing the pec major and the sternal fibers. You're just going to have even more abduction. So I flexed him, the thumb is up, I'm externally rotating him, so now it's pointing down to the ground, and then I'm coming into even more of a stretch, okay? So my patient, I'm gonna bring him out just slightly. I'm gonna have you scoot towards me just a little bit more. Thank you. So flex, I'm rotating, and then I'm bringing him into more of a stretch. Remember, I would have already done my assessment. I would have already looked to see how tight his muscles are. And do you all know how to do the length test of the lat? Okay, so your patient might get a benefit from coming past that 120 degrees all the way up to where he can tolerate. Do you feel a good stretch?
I feel like you could get more, to be honest with you.
Okay.
Yeah.
Where do you feel that stretch?
It's starting to get a little bit more.